If you're taking a small pill every morning for your blood pressure and still feeling drained by midday, noticing stubborn weight gain around your midsection, or finding that even a short walk leaves you more winded than it used to, it may be worth pausing and looking more closely at what's really going on beneath the surface. For many adults over 60, especially those who have been managing hypertension for years, there is a quiet assumption that once a medication is prescribed and numbers look controlled, the problem is solved. But modern research is beginning to paint a more complicated picture, one that suggests the story doesn't end with a normal blood pressure reading on a cuff. Many individuals in this situation are prescribed a class of medications known as beta blockers, often recognized by names like metoprolol or atenolol. These medications have been used for decades and were once considered a cornerstone of hypertension treatment. They work by slowing down the heart rate and reducing the force of contraction, which in turn lowers blood pressure. On the surface, that sounds like exactly what's needed. The numbers come down, the chart looks good, and the prescription continues year after year, often without much reconsideration. But medicine evolves, and what was once considered best practice is not always aligned with current evidence. Over the last 2 decades, large-scale clinical trials and long-term observational studies have begun to reveal that while beta blockers do lower blood pressure, they may not always improve overall outcomes in patients whose only issue is uncomplicated hypertension. In fact, in certain populations, particularly older adults, they may introduce a set of unintended consequences that gradually affect quality of life in ways that are easy to overlook. One of the most commonly reported issues is persistent fatigue. This isn't just the kind of tiredness that comes from a poor night's sleep. It's a deeper, more sustained lack of energy that can make daily activities feel unusually difficult. The mechanism behind this is fairly straightforward. By blocking the effects of adrenaline on the heart, beta blockers prevent the heart rate from rising as it normally would during physical activity. While this helps reduce strain on the cardiovascular system, it also means the body's ability to respond to exertion is limited. For someone who is younger or less active, this may not be very noticeable. But for an older adult trying to maintain mobility, independence, and physical fitness, it can create a significant barrier. Over time, this reduced exercise capacity can lead to a cascade of secondary effects. When physical activity becomes more difficult, people naturally begin to move less. Walking routines shorten, recreational activities decline, and even simple tasks may start to feel like a burden. As movement decreases, metabolism slows, muscle mass gradually declines, and weight gain becomes more likely, particularly around the abdomen. This type of weight gain is not just a cosmetic concern, it is closely linked to insulin resistance and metabolic dysfunction. And this brings us to another important consideration. There is growing evidence that some beta blockers may negatively affect metabolic health. Studies have shown associations between these medications and increased insulin resistance, higher triglyceride levels, and a greater likelihood of developing type 2 diabetes. For older adults who may already be on the edge of prediabetes, this added risk is not insignificant. It means that even while blood pressure appears controlled, other aspects of health may be quietly drifting in the wrong direction. What makes this particularly challenging is that these changes often happen gradually. There is no single moment when it becomes obvious that the medication may be contributing to the problem. Instead, it shows up as a slow shift, less energy, a few extra pounds, slightly higher blood sugar, a growing sense that something just isn't quite right. Because these symptoms can easily be attributed to aging, they are often dismissed or overlooked, both by patients and healthcare providers. Another factor that deserves attention is the risk of dizziness and falls. Beta blockers can sometimes cause a drop in blood pressure when standing up, a condition known as orthostatic hypotension. This can lead to brief episodes of lightheadedness or unsteadiness, particularly when moving from a seated or lying position to standing. In younger individuals, this might result in little more than a momentary imbalance. But in older adults, it can significantly increase the risk of falls. And falls, as we know, can have serious and sometimes life-altering consequences. A hip fracture, for example, is not just an orthopedic issue. It often marks the beginning of a decline in overall health and independence. Recovery can be long and difficult, and in some cases, individuals never fully regain their previous level of function. When viewed in this context, even a small increase in fall risk becomes something worth taking seriously. Despite all of this, It's important to emphasize that beta blockers are not inherently bad medications. In fact, they are life-saving in many specific situations. Patients who have experienced a heart attack, those with certain types of heart failure, or individuals with particular heart rhythm disorders often benefit greatly from these drugs. In those cases, the protective effects clearly outweigh the potential downsides. The concern arises primarily when these medications are used as a default treatment for uncomplicated high blood pressure, especially when better tolerated alternatives may be available. In recent years, treatment guidelines in several countries have shifted to reflect this evolving understanding. Other classes of medications, such as calcium channel blockers, ACE inhibitors, and angiotensin receptor blockers, are now often recommended as first-line treatments for hypertension in older adults without additional cardiac conditions. These medications tend to provide effective blood pressure control without the same degree of impact on energy levels, exercise tolerance, or metabolic health. Calcium channel blockers, for instance, work by relaxing the blood vessels, allowing blood to flow more easily without significantly interfering with heart rate response during activity. This means individuals can often maintain a more natural level of physical performance. ACE inhibitors and ARBs, on the other hand, target hormonal pathways that regulate blood pressure and fluid balance, offering benefits that extend beyond blood pressure control, including protection for the kidneys and cardiovascular system. Of course, every individual is different, and what works well for one person may not be appropriate for another. That's why any discussion about medication changes must be approached thoughtfully and in collaboration with a qualified healthcare provider. Abruptly stopping a beta blocker can be dangerous, potentially leading to a rebound increase in heart rate and blood pressure. Any adjustments need to be made gradually and under medical supervision. What matters most is awareness. If you recognize yourself in this description, if you've been on the same medication for years, if you've noticed changes in your energy, weight, or overall well-being, or if you simply haven't had a thorough medication review in a long time, it may be worth starting a conversation with your doctor. Not with the assumption that something is wrong, but with a sense of curiosity and a desire to ensure that your treatment plan reflects the most current understanding of your health. It can be helpful to come prepared with specific observations. Keeping a simple record of your daily energy levels, physical activity, and any symptoms like dizziness or fatigue can provide valuable context. Tracking your blood pressure at home, along with periodic checks of blood sugar and cholesterol levels, can also offer insights that go beyond what is captured during a brief office visit. Equally important is asking the right questions. Was the current medication prescribed specifically for blood pressure, or was there another reason at the time? Have newer treatment options been considered? Are there any signs that the medication may be affecting other aspects of health? These are not confrontational questions. They are collaborative ones, aimed at ensuring that care is aligned with both current evidence and personal experience. There is also a broader shift happening in medicine toward individualized care. Rather than relying solely on standardized protocols, there is increasing recognition that treatment should be tailored to the unique needs, preferences, and circumstances of each patient. This includes considering not just clinical outcomes, but also quality of life, how a person feels, functions, and engages with the world around them. For older adults, this perspective is especially important. Health is not just about numbers on a chart. It's about maintaining independence, staying active, and enjoying daily life. A medication that achieves a target blood pressure but leaves someone feeling constantly fatigued or limited in their activities may not be the optimal solution, even if it appears effective on paper. At the same time, it's worth acknowledging that lifestyle factors continue to play a crucial role in blood pressure management. Regular physical activity, a balanced diet rich in whole foods, adequate sleep, and stress management all contribute to cardiovascular health. In some cases, improvements in these areas can reduce the need for medication or enhance the effectiveness of existing treatments. Emerging research is also exploring the role of micronutrients and underlying deficiencies that may influence blood pressure regulation. For example, low levels of magnesium, potassium, or vitamin D have been associated with hypertension in some studies. While supplementation is not a substitute for medical treatment, addressing these factors may provide additional support as part of a comprehensive approach. Another area gaining attention is the importance of vascular health and arterial stiffness. As we age, blood vessels naturally lose some of their elasticity, which can contribute to higher blood pressure. Certain medications and lifestyle interventions may help improve vascular function, offering benefits that extend beyond simple blood pressure reduction. Ultimately, the goal is not to create fear or doubt, but to encourage informed decision-making. Medications are powerful tools, and when used appropriately, they can significantly improve health outcomes. But like any tool, they need to be used in the right context and periodically reassessed to ensure they remain the best choice. If there's one takeaway from all of this, it's that your health journey is dynamic. What was appropriate 5 or 10 years ago may not be the best fit today. Staying engaged, asking questions, and working closely with your healthcare team can help ensure that your treatment plan evolves along with you. And if you've been feeling that quiet sense that something isn't quite right, that your energy isn't what it used to be, that your body feels different in ways you can't fully explain, it's worth listening to that signal. Sometimes, those subtle changes are the first indication that it's time to take a closer look. A single conversation, grounded in up-to-date information and open communication, can make a meaningful difference. Not just in how your numbers look, but in how you feel every day. And at the end of the day, that's what truly matters.